Hi. Ending the HIV Epidemic, A Plan for America is the focus of the 2019 U.S. Conference on AIDS here in Washington, D.C. A pre-conference session was convened that brought together representatives from most of the 57 jurisdictions. The discussion prioritized implementation of Phase 1 of the plan, and I'm here with two of the participants. I'm Kaye Hayes, Principal Deputy of the Office of Infectious Disease and HIV/AIDS Policy and Executive Director of the Presidential Advisory Council on HIV/AIDS. I'm pleased to have with me participants that convened today. Joining me here is Marlene McNeese, Assistant Director, Disease Prevention and Control Division at the Houston Health Department, one of the 57 jurisdictions. Marlene is also Chair-elect of NASDAQ, the National Association of State and Territorial Health Directors, so she brings a wealth of information. I'm also pleased to have with me here Antigone Dempsey, Director, Division of Policy and Data at HRSA's HIV/AIDS Bureau. Welcome and thanks to both of you for joining.
Thank you.
In that convened the meeting of the representatives from the jurisdictions and federal partners, including the Secretary's Office of Infectious Disease and HIV/AIDS Policy, CDC, HRSA, NIH, and SAMHSA. The day-long discussion covered a range of topics, and we'll discuss some of those here. I'm going to start with Marlene. When you think about today, how would you describe the meeting and what happened?
You know, I was reflecting earlier, and I felt the tone in the room was hopeful, excited, and terrified all at the same time. I mean, we had an array of jurisdictions of the 57. Some are in various states of implementation of an Ending the Epidemic plan. And so I think for some of us who have already launched a plan and we're early on in our work, and for others who are just thinking about how to go about crafting a plan, we're all hopeful that we certainly can achieve the goal. But I think the realities of how to put the work together and coordinate with others and do it in a thoughtful, meaningful way is, a bit overwhelming and terrifying. But I think everybody left hopeful and up to the challenge.
Right. Antigone, what did you bring away from some of that?
Thanks, Kaye. I think what I heard, it was a wonderful opportunity for everybody to come together from all the different jurisdictions to learn from each other about what they're doing and what they're thinking about doing. And most importantly, Marlene really talked about this today, was the importance of community engagement. And how do you do that well? And Marlene, you gave some great examples today of how you've done that in your jurisdiction. I think a lot of people talked about that. We talked about the importance of lived experience, being at the table, and folks working at community-based organizations. And there's lots of different ways to have community engagement. And I thought that there were some really good examples, and people felt very energized about that. And I think people left with a lot of ideas and tools for how to do that in their jurisdictions.
I can certainly say that community engagement was those salient themes that I heard today. What else did you think captured sort of the discussion as it went forward?
In thinking about community engagement, I think the level of transparency was a common theme, and really exploring, publicly discussing with stakeholders and partners about the work we've done in HIV for the last 30 years and what we know has worked, and being equally transparent in what we know is not working. And so really approaching the opportunity for creating new or enhanced Ending the Epidemic plans that really are speaking to the gaps in the service needs of the communities today.
I think what Marlene, when you mentioned what we heard also was talking about those things that didn't work as well is just as important as acknowledging what's working, but taking that honest and having those honest discussions and saying, okay, well, this didn't work, so what's next?
That's right.
Yeah, right.
Okay, another thing that I heard was the need for jurisdictions to have flexibility in what they're doing, and that came up a lot around also their plans for ending the epidemic. So that was a big question that jurisdictions had, was, do we have to have a final plan by December 31st? And the answer was no, that it's the beginning of a plan, and that this really is an iterative process. It has to be, if it's really going to be authentic, we can't just put something down on paper and then go forward. And it's always going to be an iterative process. And I hope that today's discussion really helped clarify that. So.
No, I think, Antigone, what you're talking about, we heard it several times in the room today, like one right off the bat. Let's get clarity. When is the plan due? Is it draft? Is it final? So really touched on those issues today. Another question I want to discuss is, now that we've had this meeting and had the opportunity to talk to some of the representatives from the jurisdictions and had the federal partners in the room, when you walk away and you go back home in a couple of days and you go back up to HRSA in a few days, what do we do then? What do we do then?
Yeah. I think we've taken this disruptive innovation look like for us, and how can we push stakeholders who haven't been typically engaged into doing and acting and behaving in ways that they normally haven't been. So for us, that may mean our state Medicaid system or our federally qualified health center partners, but really helping to stimulate and engage and motivate these organizations who may not have been a part of our HIV response in the past.
That's right. And so Antigone, when we talk about this disruptive innovation, it was tasked to us as federal partners. Okay, so if you're tasking us to be disruptive, the ball's in your court too, federal partners. So what do you I know you talked about flexibility, but what else did you hear?
Yeah, I mean, I think one of the things that I took away was also we've been looking a lot at how to rapidly test and implement different interventions that are out there, but also in a way that's like, what are the flexibilities that people can have around an intervention? And so using implementation science, and we've been really pushing that at HRSA and figuring out how do we rapidly figure these out and test them in a way that people can take and use on their local level for the populations that they're serving. And it doesn't have to be exactly the same way, have those flexibilities, but also have those interventions and strategies that are going to help them to do things differently. We really are talking with folks about, to reach the people who are lost from care, the system has to be different. And we can't expect people to come back to the same system and stay in care if that system doesn't change. And so at HRSA, we've been really talking with our recipients about that and all of our key stakeholders, and we're going to continue to do that.
And I really have to applaud HRSA and its recent funding opportunities that have come out around ending the epidemic. And what's really exciting, and I think are great opportunities for these 57 jurisdictions, is looking at the flexibility that is outlined in those NOFOs and the idea that people can design a response program for people living with HIV that does not center around our traditional 75-25, core medical care response. We really can look at innovative structures and innovative interventions and actually fund that. And so I really had a chance to talk with some of our other HRSA colleagues and say, thank you. That's the direction and the flexibility that we've been asking for locally.
Perfect. And that's the beauty of having a meeting like today.
Yeah.
Is having everyone around the table and making those connections and contributions.
Absolutely.
Right. So I always have to ask this question. What else did we cover? What else do we need to share with our viewers that are listening in? What's that burning thing we want to share and leave with them?
I think a burning topic for today centered around U equals U and untransmittable, I'm blanking now, but being virally suppressed and not able to transmit the virus sexually is key. Better craft our language, and how can we better explain the important work around U equals U to some of these communities who are key in our response. And so I just thought it's important to walk away and share with others about, making sure that you're thoughtful and strategic around your messaging as we roll out our ETE responses, but certainly around some of the key strategies that we want our communities to know about.
Yeah, absolutely. Yeah, I've definitely heard that.
Yeah.
So Marlene took what I was going to say.
Okay.
So I was going to build out. You were totally simpatico there. For me, and I shared this, I was able to visit Marlene's community on one of the visits with the CDC and HRSA representation. And one of the things that hit me while I was there was that, to think that 30 years ago when I was diagnosed with HIV, I was 22 years old. There was no treatment. There were very few services. And to think that we're going to end this epidemic because of people with HIV having access to care, that we're going to end this, I'm ending this epidemic by being on treatment and being in care, and all of us living with HIV are helping to end this epidemic through that. Right. I never would have believed that is where we would be today, and it's pretty amazing, and it's a wonderful opportunity. It's scary, like you said, because people need a lot of support to get there, and not everyone is able to be there right now. But I know that we are working to help get people there, so that they can know that they're more than just a virus,
Right.
that their lives matter,
That's right.
and that
Absolutely.
it's so much more than that, and they get to help end this epidemic.
That's
So-
right.
That's right. Well, there's no better way to end than like right there. So I want to thank you for listening and tuning in. I want to thank our presenters, Marlene and Antigone. And stay tuned to HIV.gov for more video conversations from USCA 2019. And be sure to follow HIV.gov blog, website, social media, etc., etc., etc. So thank you again. We look forward to seeing you soon.